Welcome everyone, and we're going to start today with our webinar addressing career development for women during the COVID-19 pandemic in Norway. We're very excited because this is the very first event organized by the COVID-19 Taskforce that is a part of the Women in Global Health Norway chapter. So we're very happy to have you all here today. My name is Candela Iglesias, and I'm the leader of the COVID-19 Task Force for Women in Global Health Norway, and I will be your moderator today for this session. We have three fantastic speakers that I'm going to introduce a little bit later on. Well, I wanted to start by thanking the people who made this event possible, and those would be the fantastic team, the virtual events team from the COVID-19 Task Force, which is coordinated by Claudia Barth and includes Fiona van de Velde, Britt Nakstad, Elsie Sandstedt, Caroline Clark, and Jennifer Muderezi. And of course, we also want to thank the Women in Global Health Norway Secretariat, which also contributed very tight and worked very side by side with us to make this event possible. And the Secretariat is led by Ingeborg Havardsson, and also a big thanks, as always, to Gabriela Rodriguez. So what is today about? As you all may know, Women in Global Health International launched last year a campaign called COVID 50-50 with a list of 5 asks for gender-responsive global health security. During the annual conference for Women in Global Health Norway last October, we addressed asks 1 and 2. And today we're going to focus on ask 3. So we've all been hearing and reading these reports that show that globally, the pandemic has increased the already unequal burden of domestic work and childcare and care for sick people that women face at home. And this, of course, has negatively affected the career course for many women and their job prospects. These reports have also shed light on all the unpaid work that women provide, also in caring for sick people, for example. So, of course, there's global trends and there's differences between the countries. So today we wanted to focus a little bit more on what's happening in Norway. And Norway, as we all know, it's a little bit different because it's quite a gender equal country in many ways, and we have very strong social security networks, social security nets. So we want to talk about how COVID and the pandemic has affected women in Norway in particular. We'll first hear an overview of gender equality issues under the Norwegian labor market under COVID-19, and then we'll have some personal perspectives that will be shared with us from some of our speakers. Our speakers today, I'll just mention their name very briefly now, and then I'll introduce them right before they speak. Our speakers today are Mari Teigen, Anne Spurkland, and Chelsea Ranger. Mari is going to set the scene for this webinar by introducing a little bit what is happening in the Norwegian setting. And then we'll hear from Anne and from Chelsea with some personal stories, one working in academia and the other working in the private sector. So welcome everyone, welcome to our speakers. Thank you very much for being here. And without further ado, I'm going to introduce Mari Teigen, who's the research and head of CORE, the Center for Gender Equality Research at the Institute for Social Research. Her research engages with change and stability in gender relations through analysis of gender equality policy, social elites, gender segregation in the labor market, and in academia. She is the editor of the Norwegian Journal of Gender Research, the co-editor of Comparative Social Research, and a member of several editorial boards, including the member of the board Balance, Gender Balance in Senior Positions and Research Management at the Research Council of Norway. So welcome, Mari. I'm very interested in hearing what you have to say.
What I plan to do is to give a kind of a very broad overview of the gender equality situation in Norway, which is relevant for even for all the Nordic countries. We yet don't have that much studies about how the COVID-19 pandemic has affected gender equality, but that's a very important question to go deeper into. Okay, so I just would like to start with some of the important feminist scholars within this field and how they have understood the situation in Norway in a comparative setting. Helge Harnes said that the Nordic countries embody a state form that makes it possible to transform them into truly women-friendly societies. She didn't necessarily say that we were already there, truly women-friendly societies, but that there's a potential here. Sylvia Valby, which is a famous feminist scholar from UK, groups the Nordic countries as a more equal than others. And Ruth Lister calls the Nordic countries as nearly nirvanas of gender equality. So what has happened here during the recent decades is that there's been great convergence in the relationship between men and women. And one particular and important sign of this is that the participation in the Norwegian labor market show very small differences between men and women. But still, there are, of course, big challenges to gender equality, even in Norway. One thing, there's a gender segregated labor market. Some of the labels are in Norwegian. I'm sorry about that. But when we talk about the horizontal gender segregation, we talk about women and men concentrated in different types of education and work in different sectors. So in particular is what is by the SSB called health and social services, health and care. There's a high proportion of women in the Norwegian labor market work within that sector, while men are more evenly distributed on other sectors of the society. But in construction, industry, manufacturing, etc., there's a higher concentration of men. But health and care is a very important part of the labor market. Horizontally, the labor market is also gender segregated. Vertically, in the top positions, there's a big concentration of men compared to women. These numbers show the numbers for the business sectors, for the biggest companies in the biggest companies, and 40% of the CEOs are women, 11% of the chair of the boards, and there's 25% women among in the top management groups. The situation is, of course, this is the worst sector when it comes to male dominance. In academia, there is on average about 30% of women among the full professors, 35% of the top managers in central public administration are women. So the situation is much better, but still, male dominance is what characterized most sectors of the Norwegian society when it comes to top positions, and that tells us something. But what we have seen during the recent years is changes in the gender segregated labor market. As you can see on this figure on the top, there is almost only men. In the middle and also in the higher parts of the middle of the labor market, there's been a move from more women going into male-dominated occupations and sectors, especially because of the strong increase in women's part of higher education. And on what we can call the bottom of labor market, we actually see signs, not very important, but signs in direction of increasing proportion of men going in to earlier women-dominated occupations such as cleaning. But this is, of course, then mostly men with minority background and immigrant men. So there's some interest, or we should be interested in the structural and institutional factors that create the gender differences in the Norwegian labor market. So part-time work is a good example for big gender differences. Small proportion of men work part-time, and about 36% of women. It is diminishing, but there's still quite a few women working part-time. But where in the labor market? Is it all women? Is it because they have small children? No, generally not. That's not the main explanation for part-time work. In the state sector, you see that there's quite relatively few, on average, almost like for men. 13% of the women work part-time, but in the municipalities, it's 50% working part-time, and in health and care within the municipalities, 64% of women work part-time. So this does not only tell us something about what kind of work and how many hours women like to work, but also something about how parts of the Norwegian labor market is organized and makes how impact on women's working hours. Equal pay is another issue here. On average, women earn 89 kroners for every 100 a man earns. But there's, of course, big differences. So if you just look at women with a bachelor degree, you see that the average numbers is 89 per 100 kroner for women compared to men with bachelor degree. Women earn 83 kroner per 100 kroner man earn. And there's also differences related to where you are situated in the labor market. The smallest differences is in fact among the low-paid workers. The differences increases on top and medium positions, and that's of course an important reason for this is that women work more in the public sector, where the wages are lower than in the private sector. Okay. Work and family relations are changing. Sorry for the misspelling, for both men and women. We actually, unfortunately, we don't have new studies of time use for men and women. So you will see some old numbers here, but we can assume that the differences are strengthened from the pattern that we have seen, and hopefully we will have a new time use study next year. So what we see is that for men from 1970 to 2010, men's participation in the hours in the labor market has decreased somewhat, and their part of unpaid work has increased quite a bit. For women, there's the opposite pattern. Women's part of paid work has increased quite a lot throughout these decades, while women's time use in unpaid work is decreasing. And this is, of course, partly an illustration of how many hours you use at work, and also more equal sharing between mothers and fathers. Okay, so what we see is participation in higher education and the labor market. There's been a great convergence for men and women's life. But yet, men and women are concentrated in different parts of the labor market. Women work more often part-time, but this is strongly associated with sector. Health and care offers mainly part-time positions, or not mainly, but for the medium and lower levels, there are a lot of part-time work. And women earn less than men per hour because women work in occupations less valued in the public sector, in health, care, and education. Okay, so work-family reconciliation is still a main barrier to full gender equality. So what is really very interesting at this particular moment in history is how the COVID-19 pandemic may have escalated the problems, as family and care responsibility has become heavier for many, and the differences between the two areas has become blurred. For many of us, our home is the new workplace we have, and studies that has been done already indicates that women in working not working from home in the traditional, working at home now are using much more time to care for the children, and also using much more time for housework. But I still think that we need to know more about how the pandemic has influenced the work-family balance situation. But we may say that COVID-19 pandemic is a critical test for the robustness of the progresses made towards real gender equality. Thank you.
Thank you so much, Mari. That was very interesting to see sort of the starting point for the situation in Norway, and it'll be very interesting to hear more about how the new studies or the new data that is coming out will show how the pandemic has impacted this status today. It is now my pleasure to introduce Anne Spurkland, our second speaker. She works at the Department of Molecular Medicine at the Institute of Basal Medical Sciences. She's professor in anatomy, researcher in molecular immunology, author of a popular science book in immunology as well. She runs a research group which currently has 5 members and has published around 130 scientific papers. She has been participating extensively as an expert commentator during the COVID-19 pandemic. And quite interestingly, she's also a cake blogger at friekaker.no, mother of 2 adult children and grandmother of 1 very young baby. So Anna is going to share with us some of her personal reflections and personal perspective during this pandemic. Welcome, Anna.
So COVID-19 pandemic was on our horizon for some time when in March Norway actually shut down. So in the days leading up to the shutdown, we discussed at the university and at my institute, what should we do with the teaching and how should we handle this? And so this is the day before lockdown, where I had some students sitting in the auditorium and some students sitting in another room because they had to start to spread out. So 50 students were allowed to get with me and the rest had to sit somewhere else. And then I took pictures of all my notes from on the blackboard and posted afterwards in the UIO website for these things. And then the next day, I was responsible for a course, and the student had been expelled from the university on Thursday morning. They couldn't come in anymore. So I was teaching a histology course using Facebook. No students present in the room, and everything happened on the Facebook. I don't know, direct. It was a direct event. So all my 120 students had to be part of this group, and it worked pretty well. But I was not too happy because we had tried to tell IT what to do, what should we do, how should we teach. So this was just improvisation. And when I came back from this lecture, the Norwegian government had already closed down Norway. So I was teaching my lecture at the same time as this press event, where we were told that after 6 o'clock that day, we had to stay at home. So when I met with my students on the afternoon on 12th of March, we all understood we had to go home and evacuate the office and leave before 8 p.m. 18 p.m. And we had to think then, what can we do now that we cannot go in the lab? I had to bring home material. I had to talk to the members of the group, try to make plans for what we should do when we were sitting home. We had to bring the relevant papers and documents back home. So we all took home some of our lab notebooks. And then one of the members in my group asked what will happen if I die of COVID-19, because I was in the risk group, of course, being older than them. So we talked a little bit about that also, what would happen if I died. And I could assure them that if I died, the money I just had raised for research probably would stay in the group, and that I would tell my, I would inform my colleagues that they should really fight heavily to keep the money in the project, even if I was no longer around. So this was the first day of lockdown. And next day, we had all been introduced to Zoom. So IT department, which were dragging their feet and not being able to tell us anything about what we should do. On Friday morning, they knew that we should be using Zoom. So since then, this has been my tool to keep in contact with my group and my students. And this is a picture from, this is my students. We are currently one additional member now. And this is from one of our group meetings happening on Zoom. So here is me sitting at home with my green screen, hiding everything which is behind me. And what did we do then, sitting there on Zoom? Well, first my students taught me how to use Zoom because they figured it out extremely quickly. So we had an hour of practice, figuring out how to share screen and so on. And then we decided we had to write the review that we had been planning to do for some time. So we set up a structure to write the review on our favorite topic. We made the disposition, we shared the work between the members of the group. We had regular Zoom meetings to discuss how the work proceeded. And we made a document on the web so that everyone could edit at the same time. And this worked really well. So after 2 months, the review was finished and accepted for publication. So that is one of the output we have had during the pandemic. Also, I asked my technician who normally work in the lab, I asked her to sit down and learn a new technique and give us a presentation of that. So I learned the basic principles of a rapid DNA test that I didn't really know from before, and which is relevant for the pandemic. Another student gave us a presentation on SARS-CoV-2 biology, which was informative. We planned new research. I tried to encourage my members to do virtual experiments in openly available databases. And we did paperwork that were seldom updated. So through the pandemic, we have now a digital ordering book, and some of the members have updated their lab notebooks with indexes and so on. So we have tried to do as good as we could, and then luckily we were allowed back in the lab after 2 months. We could start to work in the lab, but mainly staying at home as much as possible. That means I have mainly been at home. The students have been in the lab. So we have had regular group meetings on Zoom, and it works actually quite nice, nearly as if we are together. So we use share screen to show data, and we use whiteboard to discuss concepts and make drawings. similar to what we do when we have a piece of paper in front of us. We have literature meetings in the same way, which is actually quite nice, where we choose papers we want to discuss in detail, and that paper is then screened in Zoom, so we can all look at the same figure and comment on what we think about the different data parts. One of my students took the initiative to start to write post-peer reviews, which are summaries of our discussion, and he posted this on PubPeer, and that allows us to engage with other authors, with the authors on PubPeer, and that has been partially successful, partially it has been interesting. So instead of going to scientific meetings, we have instead tried to engage in scientific discussions via this open platform for commenting on published papers. We have to some extent had Zoom meetings with international collaborators. This is an obvious opportunity which the pandemic has demonstrated for us, that we could actually talk with anyone around the world very easily via Zoom. And my students also has had some social interactions, more on Kahoot and other things. They normally would have met in person, but they have tried to keep the social activities ongoing on Zoom. So what about work-life balance during the pandemic? Well, since I no longer have small children, I would say it overall has turned out to be very positive. There is no time spent to commute to work. I live outside Oslo, so that is 1 hour 40 minutes saved per day. Normally I use that time for reading stuff and so on, but anyway, it's time I don't have to spend. I don't spend time for shopping and cultural activities or so that means that I save time there also. So it gives me a lot of contact with family members at home, which is essentially my husband. And since I like my husband, it has been a nice time together with him. The negative side is that there is very little physical activity during the day unless we force ourselves to go outside. So there's no automatic activity because you are commuting or because you move around in the building. And the small talk with colleagues is really difficult to replace with Zoom calls. I've tried to contact some of my small talk colleagues and it doesn't really work. And contact with friends, it's the same. It's difficult to fully replace contact via Zoom calls. Undetermined, as you heard in the introduction, I have had enormous pressure from media and journalists to get comments from me on COVID-19 relevant stuff. And particularly in the start of the lockdown, I spent very much time on that. And so that could be kind of my babies. Instead of having children, I have attended to all the journalists, which has taken the same amount of time and effort. So spending time with your children at home, it is positive, but it also distracts from the main your main tasks. So I put up this on the work-life balance, the challenges and opportunities. The children has needs and the partner has needs, and how to balance this. Well, I don't have any answer specifically, but I think that if I had children at home and had been kind of 20 years younger, I think there might be some interesting opportunities here, which I would have tried to implement. And one thing is to organize the day so that there's a list of things to do at work, at home with the children, and that should be put down on a piece of paper. And then as you go along during the day, you just cross out what you have done. That helps to structure what you are supposed to do, and it helps keeping focus. And at the end of the day, you can look at all the red marks and say that it was quite okay this day also. And then, of course, adults at home should share the work between them. It is not acceptable that one of the adults is doing everything and the other adult is doing every work-related thing. That is really important. And for Norwegian women, it comes hopefully relatively natural to expect that the partner is doing his share with the whatever is necessary to run the home. My husband, at least, he does his part, absolutely. But that is, for me, an obvious thing. Of course, we should share the work. And then well, people live in different places and have different size of their home, but still I think to have zones of activity in the house is a good thing. So there could be one silent zone, one work zone, one leisure zone, and also remember to go outdoors. And if you have a really tiny place, still, I think it is better to sit somewhere else than in your bed to do your work. So to change position during the day and have different spaces, I think that's a good idea. And then I think that the pandemic has allowed to explore the benefits of boredom. Because without all the activities that distracts from thinking, this has perhaps been and still is a time for doing something different. So children and adults are overstimulated, and I think that I will look back on the times of the pandemic as something mainly positive, and that is because we have had the possibility to kind of get speed down in our lives. So the pandemic may be an opportunity to rediscover old pleasures. For instance, reading books, drawing on a white sheet of paper. My children, when they were small, we read a lot aloud for them, and we also at some time point managed to make them draw what they were listening to. So the combination of reading a book aloud and drawing what you are listening to may be very good, very good activity for the whole family actually. And all of these drawings can be collected in a binder, and it could be kind of this are drawings for Lord of the Rings or whatever you're reading. Puzzles, old-fashioned puzzles, and many pieces. For me, that is one of my favorite activities when I was young, and I see that many people have actually found puzzles again as an activity to do. Writing also, why not write a diary or write texts which can be used for later purpose or just for entertaining yourself. Making games may also be a good idea, to invent games or whatever. The list is of course longer.
Thank you so much, Anna. That was, I think I recognized myself in many of the things you said, and it was a very nicely balanced perspective. Our third speaker today is Chelsea Ranger. Chelsea comes from the US and holds a Bachelor of Science in Pre-Health Biology and a Master of Health Sciences in Physician Assistant Studies. In the US, Chelsea worked in Atlanta in a private practice, treating patients with acute and chronic liver disease. She also trained student physician assistants and was a lecturer at Mercer University. She relocated to Oslo in 2019, and she found that she needed to transition careers. So over time, she entered into the life science and health technology sectors. Until 2018, she was the general manager of Norway and senior vice president of commercial strategy for the medical imaging company Ambra Medical. And in 2019, she launched her own strategy consulting firm and now supports life science startups, small and medium enterprises, and cluster organizations across the Nordics with clinical and business strategies, investor relations, and stakeholder engagement. So Chelsea is going to share a little bit of her own personal perspective from during the pandemic. Welcome, Chelsea.
Thank you, Candela. Yeah, so thank you all. It's really nice hearing you, Mari and Anna, and your perspectives. I'm going to be talking a little bit more historically about where I have come from and what that has allowed for me during the pandemic. And I hope that some of the strategies that I might have used might apply to some of you today. So I've had to redefine my career twice. I've had to transition my career twice in the last 12 years. I also became a single mother as well as the primary caregiver. I've been an expat, so I've had to do the language and navigating social and professional codes and translating all of that into a new setting. So when I think about COVID and I think about how some of the women can be impacted when we talk about potential job loss or having to transition into a new setting, potential difficulties in finding new work, more work at home, of course, and also potentially needing an income where you also need flexibility. So these are kind of some of the things that I've experienced that I'm going to be speaking to. So Candela did a really nice introduction. So I moved here in 2009, just let me say, not 2019. I've been in Norway for a little while, so I'm not fully integrated yet, but but I do feel like I've been here for some time. As Candela said, I came from the US. I have a background in medicine. So we have a bit of an interesting healthcare system in the United States because we have nurses and we have physicians, but we also have two what they call mid-level provider degrees. So one of those is a nurse practitioner where you're trained on the care and management model of a nurse, but you can write some basic prescriptions and you can operate in a private practice setting. Physician assistants are trained on the diagnose and treat model of a physician. And so we typically enter into private practices or hospital settings to assist physician teams in seeing additional patients. So I am a physician assistant by training. I specialized in liver disease and GI diseases, and I was working at a private practice in Atlanta. In 2009, I moved to Norway with my then partner and an 8-week-old baby. And I didn't know much about Norway before coming here. So I ended up in a new setting where all of a sudden I applied to NOKUT and found out that, my degrees were approved, but of course I couldn't work in a clinical setting because I'm not a nurse and I'm not a physician and I sit in between. So all of a sudden I realized, okay, I'm going to have to take all of these skills that I've learned in my life and I'm going to have to try and find a new way to apply them to what is applicable in Norway. So, it's important at that point to sort of acknowledge what is the context of that. Well, I didn't have any language. I didn't understand the culture. I didn't have a network. My visa was delayed for 2 years, which meant I couldn't travel, couldn't take studies, couldn't work. So there was a gap in my CV. I was at home for 2 years taking care of my son and sort of migrating the red tape that it took to become legitimate in Norway. And then I became a single mom and had to figure out how to do it on my own. So at that point, I start thinking about, well, what are some of these things that we've described that some women might be facing during COVID? Well, I was facing a lot of those, right? I needed the flexibility, I needed the income, and I needed to figure out how did one set of skills apply to a new environment. I had to be humble about it, and I had to take jobs that were sort of outside of my scope and maybe beneath the roles that I would have traditionally considered myself for. But I had worked as an intern years ago in communications consulting. So I took a job at Berlitz Language School and began teaching English. I was lucky in the sense that there are a lot of corporate personnel, even individuals in the ministry, and they're constantly giving presentations abroad. So they really needed a primary English speaker that they could work with to practice navigating the language in a way that they felt comfortable. So that was quite interesting. And I also made some good friends there, and the networking was important. I wasn't getting enough hours within that position, so I ended up working in a cafe. There was an American cafe at that time based in Frogner. So I took a job, giving coffee and delivering food. And that turned out to be really rewarding as well, because the expat communities tend to be quite strong in how they network with one another. So I was able to really focus on my networking. But I really wanted to get back into a medically oriented field because, of course, that's what I'm trained to do. It's what I love. So while I was working in the cafe, I started looking for alternate roles. And I came across an advertising company in Oslo. Advertising is definitely not something I was looking at doing. It is really difficult to actually do it. But they were building a life science sector within their organization, and they needed somebody who had a medical life sector background that could help them to really orientate that division of the company. So when I first applied, I was actually told that I was overqualified. I was denied the role. I had to convince them to hire me, and I really had to stress the fact that, you know, I'm willing to do things that are outside of the box of what I've done before. It was telephone sales, so I mean, it was the rough of the rough. But working in that setting really gave me some interesting opportunities, because even though it was phone sales, you know, there are lots of ways that I could incorporate skills that I already had, but also really expand my skill set. So I'd never done sales before. That was a whole new environment for me. I'd never worked directly in marketing, branding, and graphic design. So those were all things that I was able to participate in. I also, so we're talking, this is around 2013 when this job started. I'd never had a LinkedIn profile before. I didn't really understand the purpose of LinkedIn. To me, it was just sort of a Facebook-ish thing. But what I learned is that I was networking with people on the phone. I was building these contacts, and I really wanted to condense them. So LinkedIn became sort of a primary focus for me, and ultimately has ended up being one of the strongest professional tools that I have used. Um, what else? Let's see. I mean, I worked in project management, and then also what was really interesting and what launched me into my career was that the life science products that they were building in this advertising company, they really had them situated in Sweden. They had orientated themselves towards the Swedish market. I was able to do business development and expand the company into 13 new countries that they'd never existed in before. And what that meant is I was meeting government personnel, research organizations, those who were behind public-private infrastructures, those who were leading different university programs, as well as those who were in the startup community. So even though it was all over the phone, I was able to build this network, condense it into LinkedIn, and then utilize it to move forward in my career. I ultimately ended up meeting a startup company out of Sweden. They had a couple of developers and a CEO, and I was really interested in their technology. And I ended up selling the CEO into one of my projects. So it turned out I was okay at sales. And then he poached me. He wanted to hire me into his company. So I took on the role of head of business development for this startup company in Linköping, Sweden. I worked remotely, mostly, you know, Teams meetings from Norway. Interesting to note, one of the reasons that I found a job in the Swedish market was because at the time, most of the small companies within the life science sector only had websites in Norwegian. So at the time, our life science sector was very much in the early stages of its maturity. It's grown a lot in these years, but I couldn't find a fit for myself at that time in Norway. So I actually had to be willing to work abroad. And that also meant that I had to be willing to travel. But fast forward a few years, so from 2015 to 2019, the company in Sweden, Amra Medical, grew to over 40 individuals working there. We gained international pharmaceutical investors. We had a great advisory board. And so we really were commercializing everything we'd set out to do. At the end of 2018, actually, the company took on a new CEO and migrated a lot of its work to the US. So at that point, right before Christmas in 2018, I was laid off. So I found myself unemployed and trying to figure out, okay, so here we are, I'm going to have to go back to my core and figure out what it is that I want to do and what it is that I can do. And by then I had worked in a number of different settings, right? So I think one of the biggest assets that we can have is not only networking, but also really being able to understand and articulate what our skill sets are. But really condensing what we're skilled at, I feel like is a challenge. It's a project that you actually have to work on. So there were two things that I did in order to be able to understand how to do that. And one was I reached out into my network to women who inspired me, women who had really made it to positions where I was interested in growing, or who had skills and networks I was interested in learning about. And you know, I think as women, one of the most important things that we can do is let down the ladder for one another and really offer each other the insights that we might have so that we can support one another in growing forward. And these mentors were really great at doing that for me. The other thing that I did was I signed up at AS3 for an executive leadership training course, which is where I sat with a woman who is Norwegian, but she'd lived in the US, she'd worked in industry, she'd run her own company, and her job was to help me really identify and articulate these skills. So once I started really taking that pause in unemployment and understanding what it is that I wanted to do, I started looking for my ideal job. And the truth is, the ideal job for me is one that allows me to be flexible in my home life, that allows me to be financially independent and allows me to continue networking. So it sort of spurned on this idea that I would start my own consulting company, which is pretty aptly named Sea Ranger Consulting, because it is just me. So I built a website and used that website as a platform to articulate my skills. And on the day that I launched the website last year, that was the day that I landed my first client. And since then, my client base has really grown. I'm now working full time. I have a number of different positions in which I'm working. I have full flexibility in my schedule. I have the financial independence that I need. And so when COVID hit, I really had, from a professional perspective, the tools that I needed to be able to support me. I also have a partner who's a teacher. So when my 11-year-old son needed to be homeschooled, we really balanced that between each other. We also share the domestic work. I mean, COVID's been hard. We all know this, and there's a number of ways in which it's been difficult. But from these particular aspects, I feel like we have been prepared. So that's basically, if I boil it down to 3 things that I would offer to women, it would be social capital. It's the sum of everybody that you meet and network with. It's key. Most of the jobs that you're going to find aren't on Finn, they're in your network. We're always students, and so we need to grow our skills and be able to articulate them. That would be the second point. And the third point is mentors make all the difference. And so I recommend everybody to look for them. So that's my story.
Thank you so much, Chelsea. That was really inspiring, and I love your 3 lessons. We have 10 minutes for questions, so I would ask Chelsea, Anna, and Mari to please turn on their video camera so we can see you. And I'm inviting the participants to please put your questions in the Q&A. And we already have one first question for you, Mari. I'm gonna start it off. Basically, actually 2 questions. The first one is if the data that you presented was disaggregated by ethnic background, and if you can talk a little bit about this. And the second one is if you can give us a little bit of a hint of what type of COVID or pandemic data is the center collecting or working on.
Okay, yes. When it comes to this aggregated on ethnic background, I mean, I was presenting different sources of data, and some when we are using registered data, it's possible to also look at gender and ethnic differences. I mean, it depends actually on how big the data material you are using, whether you can say something interesting on ethnic differences. We know a lot about ethnic differences in the Norwegian gender and ethnicity in the labor market, especially that there's a lot of variation. I mean, in the general numbers show smaller, lower labor market participation among ethnic minorities and also among ethnic minority women, but there's a lot of differences between different groups, for example. And we also have studies on gender equality attitudes along gender and ethnic lines, and we also see that especially second generation have very similar opinions on the importance of gender equality and sharing of work and family burdens and so on for both men and women. Okay, when it comes to, I mean, there are, I mean, although I think it's very important what Anne, for example, was saying, that of course the father and the mother should share care burdens and things like that, but still we see from studies, and also the studies that has been done this far, that women take up on them more of the care burden in relation with children, and also elderly relatives and so on during the COVID-19 pandemic, and this will probably have consequences for careers and productivity and so on. But that's one part of the story. But another part of the story is that different parts of the labor market has been affected very differently by the pandemic. I mean, if you are in at least parts of health and care professions, you have really not been staying at home, but had a really hard time at work. So I mean, there's not one story, but for the families that has been working from home, there's quite good indications that there are gender differences that may have an effect on the long run. But I mean, it depends a little on when we how long time it will take before we are back in the normal situation.
Thank you, Mari. We're looking forward to more data when it starts coming out. I see that some people are raising their hands. Please just type your question into the Q&A chat, and I'll pass it on to the speakers. Anne, you were talking about the work with your students and your research team. I was wondering, what are your thoughts on how has this impacted students, and having to publish and all the push to publish and so on? How is this impacting academia from the perspective you have from your students?
From the perspective of the students, the pandemic has clearly been a problem. So we had, I have one PhD student who is now in the middle of her 4-year period. She has got 1 year for teaching, so that's why it's not 3 but 4 years. And the plan for her was that last spring she should go to a collaborator in Scotland and learn a technique. That was the original idea, but that is not going to happen anytime soon. So she may be finished. It may become irrelevant for her to go to do that research visit, for instance. And we stayed at home for more than 2 months, and experiments were planned, and they were just postponed. And even when we could come back, it was not as efficient as it was normally. So, but the students have been compensated with some additional time because of this. So I think all our PhD students have got 2 more months of contract to partly compensate.
Yeah, that has to be tough for sure, because it was more than 2 months that were possibly lost also to mental health challenges from the pandemic, for sure. Chelsea, can you very briefly mentioned at the end this idea around social capital, and I think there's an interest on hearing a little bit more about what you mean by that.
Yeah, absolutely. So social capital really is your network, right? It's your network, and it's how you are able to utilize that network to really, to grow both personally and professionally. It's interesting to note. So I really harpened for a minute on that LinkedIn, because I think LinkedIn is an underused tool for a lot of us, right? And actually, I would say that LinkedIn has been the sole source of the majority of the contracts that I've ended up landing right now. They've come through existing networks. So when you enter into a role that you think might be an innocent role, whether it's from a social perspective, joining an expat group or a career development group or a dance class or a theater group, whatever your interests are, I think it's really important to note that in Norway, we are a small community, right? So finding opportunities for launching your career is really built upon the social capital that you grow, which is the networking that you do both through hobbies and work.
Great. I think that's a very, very useful tip for everybody. We unfortunately ran out of time. We had so many other things that we wanted to discuss with you. I want to say thank you to the speakers. It was really fantastic. I loved how we had a little bit of data, a little bit of personal views and personal perspectives that really enriched the conversation and the discussion. Thank you to all our participants. Thank you again to the virtual events team that organized this webinar, and of course to the Secretariat for making this whole thing possible. And we welcome you. We'll have more of these events, and we'll have also some interesting interviews that will be coming out from the work of the COVID-19 Women in Global Health Norway Taskforce. So stay tuned for that. You'll get messages on that. Have a fantastic afternoon, everybody.